Hi, good morning, everyone, and thank you for joining this webinar to stand against stigmas of mental illnesses. My name is Joshua Kuan, and I'm a student of psychology in Segi College, Kuala Lumpur, and I'll be your moderator for today. The objective of this webinar is to address the common stigmas of mental illnesses. We will talk about the facts and myths about mental illnesses, and we will take a look into how a mental illness survivor go about her daily life. To speak on this, we have two speakers. Dr. Maniam, he's a professor of psychiatry at National University of Malaysia, and Eunice Lee, she is a student of psychology in Segi College, Kuala Lumpur, and she's a bipolar disorder survivor. So good morning, Dr. Maniam, and good morning, Eunice.
Hi, good morning.
Good morning.
Good morning. Okay. We'll go right straight to it, yeah? Okay. Dr. Maniam, as a professor of psychiatry, what's your experience with mental illnesses from the patients that you have treated?
Okay. I work as a professor of psychiatry for many years. My job involves teaching psychiatry to doctors and to specialists, as well as treating psychiatric patients. So about half my work is treating people. And so I treat a wide range of psychiatric disorders. Since I work in the hospital, the UKM hospital in KL, we have inpatients, so we treat the very serious illnesses as well as the milder illnesses in the outpatient clinics. Besides, I teach therapies, cognitive therapy, and to patients and to students as well. Okay.
Okay, thank you, Dr. Maniam. How about you, Eunice? What's your experience fighting mental illnesses as a bipolar disorder survivor?
It's been around 8 to 9 years now. I'm into treatment. For me, my experience is wasn't really a good one. But I consider it a bittersweet experience. I would say I was actually first diagnosed with major depressive disorder or clinical disorder. Clinical depression. In 2017. That one is when I was 17 years old. And then and I was prescribed antidepressant. As I remember, that time they prescribed me an SSRI. Antidepressants is a type of antidepressant that target your serotonin in the brain. This also called is the SSRI stand for selective serotonin reuptake inhibitor. So it targets the chemical in the brain called serotonin. And also throughout the years, I've been experiencing and also my type of bipolar. Two types, which is bipolar 1 and bipolar 2. I was diagnosed with bipolar type 1. We'll tell you the difference later on. But I've been throughout my years, I have a lot of manic episode, which I ended up doing reckless things, and I have a grandiose idea. And I speak very fast. I have racing thoughts, and my racing thoughts are kind of like too very fast that I ended up speaking very fast. And because my thoughts is running very fast, so the manic episode is totally like all over the place. And also my risky behavior, such as I have also risky behavior such as spanking spree. This is quite embarrassing, but yeah. And also to note that during a manic episode, I don't have any awareness of it because I just feel good, and but it's just that I do feel irritable, but at the same time also I feel good. I have a lot of energy. I feel that I don't need to sleep much. No, usually I could go like 2-3 days without sleeping, or if I sleep also, I sleep maybe 2 to 3 hours, and then that's enough. Usually a lot of things I'll do are hyper focused on things that are totally useless. Actually, the like our our collect things, our do a lot of things that are unnecessary and things like that. Also, I've experienced quite a number of quite a lot of depressive episode as well. Which today I was depressed. I'm not really sad because sadness and depression are two different things. I was very fatigued. Have no energy, and then also also during that time also same as many episode, I don't sleep, I don't eat, but in depressive episode also, like I don't really sleep much. I have trouble sleeping. It's not that I don't want to sleep. It's just that I have trouble sleeping, and then I did not eat. I self harm, and it basically I just don't feel like doing anything. It's because I feel like a heavy weight on my shoulders, and also I had also during this episode, I try I have tried to take my own life before multiple times. I've tried to take my own life, but I failed the attempt. Uh, which yeah, and also I've mixed episode with which I experienced manic episode and depressive episode together. This one is the worst episode I could ever experience. Because at the same time you feel tired and you have a lot of energy at the same time. You want to do this but you have no energy kind of thing. Uh, it's kind of like everything together lah. Uh, and then I have hallucinations as well. That one is especially when I'm in a depressive episode, bipolar depression, where I will hear voices of people or voices of people talking about me. Like I always had the belief that the neighbors are actually talking about me because I could really hear it. Like people outside talking among each other, and I will ask my mom to actually, mommy, is there anyone out there? And she'll go outside and check it for me. I said, no one. I said, there's surely someone out there. And then she said, there's no one. What's wrong with you? Just, I didn't tell her because I don't want her to freak out. But at the same time, but at the end also I tell her lah, because she's my mom. At the same time also, for to treat my bipolar disorder, the treatment I've been through was medication such as antidepressants, antipsychotic, anticonvulsant, and also lithium, uh, and talk therapy such as cognitive behavioral therapy, and and also I've been uh, hospitalized before against my will. Some of them are okay, fine. I was still okay, but there's a few times that I got hospitalized against my own will, and I have to do it. And because I was in a very bad shape, I relapsed, and I fall very bad. That I had to do ECT, which is electroconvulsive therapy, where they administer currents to your brain to help reset your brain. Yeah, just all. Yeah, just my experience with bipolar disorder.
Thank you very much, Eunice, about that insight. Okay, in your opinion, Dr. Manian, what are the differences between mental health and mental illnesses?
Okay, let's start with mental health first. Uh, Mental health is not just the absence of mental disorder. Just because you don't have a disease doesn't mean you're mentally fully healthy. According to the World Health Organization, mental health is a state of well-being, about feeling good about ourselves, where an individual realizes his or her own abilities. They can cope with the normal stresses of life. They can work productively. They are able to make contribution to society, and they feel it's emotional, emotionally comfortable, generally speaking. But illness, on the opposite side, causes a lot of emotional distress, emotional pain. And some patients say emotional pain they suffer in depression, for example, is a worst form of suffering. And then also, when there is mental illness, people's thinking is affected. They find either their thinking is distorted or difficult to think. Their behavior may change and also their functioning. This is very apparent. They cannot function socially as before or in their work, in their studies. So you trust between health and illness. So in one situation, you feel well and you're productive and you can mix around and do things as you would like to. And the other hand, the illness, it drags you down. You're unable to function properly. You behave in an unusual manner. Thinking is difficult and a lot of emotional discomfort or pain, distress. Okay. You're mute.
I'm sorry, yeah. So, Dr. Maniam, thank you. So, there are some myths and stigmas related to mental illnesses. So, can you give us some examples that you know of?
Oh, yeah. People, human beings, when they don't understand something, they create their own ideas. And many of these things are, mm, are myths. They are their own mythological ideas about what is wrong. And so, because people don't understand what mental illness is, that it is actually a combination of physical and psychological illness. Because in mental illness, there are physical changes in the brain, actual physical changes in the brain, and that it is also caused by some genetic factors and so on. Because people don't understand, they form all kinds of quite absurd ideas. For example, some people, one of the myths that people believe is that it's all in the mind. It is not a real illness. People are imagining it, and they tell the patients, snap out of it, get out of it, don't think like this, don't do this, because they just don't understand this is an illness. You cannot tell a person who has a broken leg, to run. And you say, why you cannot run? You can run. Your leg looks okay, what? This is not legal. But that's how people talk about mental illness because they don't understand. Another myth is they think people get mental illness because of a weak personality or character flaw, but this is not true. Mental illness is caused by a number of factors. Genetics is very important. Physics in the brain is very important. The environment also affects it. Yeah, the upbringing, so on. It does. So it's a combination of physical, biological, and environmental factors. The myth is people think it's all spiritual, meaning you are, blessed or you're charmed or things like this. Um, and so they tell these people, you cannot treat this with medicine. You must go and see the BOMO or see the temple medium or priest or whatever, and do all the jumpy and things like this so that you can get well. This is completely wrong idea, you know. And then the other myth is that is mental, illness is people with mental illness are violent people or very dangerous people, or that this mental illness is infectious. If you go near them, you will get it. You know, so I've heard people say people. Psychiatric doctors and psychiatric nurses will get mentally ill because they work every day with mentally ill people. These are all this very very unhelpful and often painful ideas, and they cause a lot more harm and a lot more suffering to people who have mental illness. I'm sure uh, later Eunice might be able to add to this from her own experience. And these myths will, because of these myths, people tend to stigmatize mental illness, which is something we'll cover in a little while. The stigma of mental illness. Okay.
Okay, thank you very much, sir. So, hi, Eunice. Do you have anything to add to this myths and stigmas that you have normally faced, that you normally hear to?
Yes. Okay. First of all, I want to say that a lot of people have uh, they think that psychiatric medication are bad, which when I was taking it, from my experience, when I'm taking it, a lot of people in the beginning, a lot of people just say, don't take the medication, take more vitamin supplements, and go and do go and pray, go to the nature and meditate or something, things like that. But the fact is, um mental people in mental illness, they need medication to actually survive, just like when you got in just like when you have like a chronic pain or fibromyalgia, for example, you need to take painkiller every time because they have like a chronic pain like that. And then you don't go and tell the person with fibromyalgia and myalgia that, hey, don't take painkiller, it will affect your kidney and then it's not good, like that. You don't go and tell them like that. And uh, and the same goes to mental illness. You don't go to the patient and tell that, oh, don't take this medication, it will affect your kidney, it will affect your liver and things like that. And I heard a lot of, like, even my family members and my relatives also, they told me the same thing, which I try to explain, but a lot of time they just like, oh, okay, you don't want to recover and you just want to depend on your medication, things like that. And the second myth is, pills solve everything. So it's like, for example, let's say from my experience and from uh other patients that I know, they either have this, uh people will tell them, like, your own medication, you should be alright and things like that. And like, for example, when I get moody, let's say if I was upset over something or I was moody, and then people ask me, do you take your medication today? Which I just replied, yeah, I do take my medication. Like, what's wrong with me being moody? Like, I'm a human, and yes, I'm a mental illness patient, but also I have the right I have the right to have those feeling like so-called normal people have, which which mental illness patient, they are allowed to have uh emotions that normal people have, because we are all humans. It's not that because pills are not a happy pill. It's not like you take it and then you are good. If let's say you were to tell someone, uh with diabetes, like say you if they say they just say like you wouldn't tell them like when they say they don't feel good, do you take a medication or if any other thing, let's say, because sometimes for example another one would be just now I gave the example about the patient with fibromyalgia and they have to take painkiller every time, and then if they complain pain, you don't ask them, do you take your painkiller? I'm sure basically they did take it, but sometimes painkiller cannot like prevent the pain. So the same way. And also myth, the other myth that I encountered or what I see around me was that your mental that um your mental illness defines who you are, the mental your like people with mental illness def that person are their illness. So I want to say this, right? This one is people, for me, even I experienced as well, and people didn't see the real me. People didn't see the real me as because people see my illness, and that's how they define me. And just like cancer or diabetes, you don't tell, like, your illness is you because you eat, for example, if they got diabetes, or because you eat too much sweet, that's why, like, you are what you eat, things like that. You don't just tell them like that. Or cancer patient, sometimes we also know that certain foods can cause cancer, but we don't go to the cancer patient. That's why, lah, you are what you eat this one, that's why you got cancer, you are what you eat. That's why we don't go there and tell people like that. The person the patient the person is the person, the illness is the illness itself. So it has nothing to do with with our personality. Yeah, when we are not well. And also, people with mental illness are weak and they are lazy. It's just say that like Prof Maniam say, a lot of people think that mental illness can be just snapped out it, or they're lazy. They don't try hard enough, or they're weak because they don't have a strong mind, things like that. And this one, to be honest, I can see a lot of but right, for example, people with depression, right, you see them as lazy. Maybe they sleep a lot and things like that. But little do you know that their illness are pulling them down, and they are trying to resurface, like keep their head above the water. They actually they actually are strong. These people are strong, because I don't think mental health patients are weak, because we try every day to survive. We try every day, even though we are suicidal, we try every day to avoid harming ourselves. We really do our part. We do our part. Mental illness patient, they do their part, so they are not weak. It's not that they don't try hard enough. They try their very best, but still they are like that, because it's the illness. It's the illness that pulls you down, that makes you vulnerable. Yeah, but this and also, mm, uh, people with mental illness have to little to no faith in God. And the reason why the patient have mental illness is because the devil control them. So this one I can say, um this one I think so is not true. Is not true, because I can see a lot of people, they pray, they just they read their Bible, for example, and things like that, and still they say they have no faith in God. Like, every for me, right, I remember just once I was in church, and I want to talk about my problems with it, and problems with my mental health. And they should ask, do you pray? I'm like, what? Yeah, I do pray. Yeah, I do pray. I pray every day. Yeah, I do pray. And and um there's other people who actually texted me and tell me, if you continue like this, the devil will be with you like that and things like that. If you don't want to change, the devil will forever control you. Things like that, and which I think is false. And this one, imagine let's say people are if let's say people the people who haven't been diagnosed but they have some symptoms, and then imagine people around them keep telling them, I think the devil controls you. I think you should go for this healer. Go to this like Prof Maniam say, which is false healer. This is very dangerous actually. That this can prolong the affected person's symptoms, and because of the surrounding, they keep telling this person that you need to go to this bomo, you need to go to this healer, you need to go to this sorcerer and things like that, the false healers. And they ended up going there and they didn't get proper scientific medical treatments, which could make it even worse and worse. And by the time they go to medical when at that time when they go to seek medical help, it's already like too late. I mean, like you still can recover, but it's already like you are in. The person will be in a bad shape already. All right, and another myth is children and adolescents cannot have mental illness, which I think is false. Okay, because I developed my illness when I was adolescent, when I was a teenager. But I heard of my mom that I already developed it when I was around 8 or 9, because I started not sleeping. I started walking around the house and things like that. My mom told me that, which it is not true. Children and adolescents can have mental health issue. And the sad thing is, many parents actually they think, oh, it's just a kid thing. It's just a my kid is just going through puberty, so probably he's moody and things like that. And yeah, and because there's not much education about child and adolescent mental health. That's what ends in tragedy. And also having mental illness means you are crazy. I can tell you, if let's say everyone with mental illness are crazy, I don't think so. You can have a lot of like, I think so everyone including me will end up in the institution lah. So yeah, and here I am. I'm still here living, studying. And also the last thing is, yeah, it's related to bipolar. People with bipolar disorder are moody. So it's not moody. Bipolar disorder is not about mood swings. It's about the cycle. We don't swing like today I'm happy, the next day I'm depressed. That is not bipolar. That's how I go. I like when people ask about it, when people talk to me about it, I say, oh, I have mood swings as well. I was like, come on, bipolar disorder is a cycle between a manic episode and a depressive episode, which manic episode take 4 to 1 week, 4 days and above, to consider as mania. And we don't just think like happy sad. No, we will go with depression for many weeks, and then we will end up and then no, we will have mania for many weeks, and then we will fall to depression many weeks. Yes, just like that. Yeah. And also, uh just now Dr. Maniam say that people with mental health issue, people with mental illness are dangerous and violent, and also might be unpredictable. This one, right, it's very sad, because this is the worst stereotype ever, because this how the news media portrays the criminal that involved when tragedy happens. Like if you are like me and you love to watch crime documentary, I can tell you almost every crime documentary that I watch, they will just say this particular criminal have some sort of mental illness. Either they have schizophrenia, they have bipolar disorder, they have schizoaffective disorder, they have antisocial personality disorder, they have narcissism and things like that. In which I just feel like it's very sad. This adds more to the stigma. Yeah, it brings more trouble. Thank you. Yeah, that's it for me.
I see. Okay, thank you very much. Eunice, as a disorder survivor, how do you go about your daily routine, and how do you cope with the relapses that you normally have?
Um, so I think we should talk about common stigma first, right? Towards Dr. Maniam. The next question.
I've already asked already. I've already
Uh,
covered that question.
okay, alright. So what my day? Okay, as a bipolar disorder survivor, my daily life. Okay, first I will start with my daily life. Okay, my life is just typically like a normal person's life. I'm a psychology student in Sergi. So basically my daily life, my daily routine will be, wake up, make sure to take my medication, never miss my medication, because it will bring to disaster. And then if I have class, then I will attend class. Then if no, then I will do other stuff. And also then I'll go about my life, going just hang around with friends. And then at night make sure to take my medication as well. Then I'll go to sleep. But some days I have to go to the clinic, my appointment with my psychiatrist. And it depends on my daily routine. Actually, it depends. Let's say if I'm stable, or if I'm in a manic episode, or in my depressive episode. So so that's now that's about my daily life when I'm stable. But what if I'm in a manic episode? So when I'm in manic episode, usually looking back, I pretty much have destroyed myself a lot. I did not sleep at night. I can go days without sleep. I wouldn't, because my daily life I would eat and things like that. Um, I will start doing some kind of hyper focusing on something nonsense. Then I will have grandiose thought, and I will call up people, and I will talk very fast, and I will talk about my grandiose thought. But mind you, I have only reached until grandiosity, but no, I haven't crossed the line. I never crossed the line to grandiose delusion. Yeah. So, and also spending free, risky behavior, spending spree. And also, um, what else? I have a lot of plans and idea. And also I couldn't function because I wish that to the manic state where I have ended to be hospitalized. So which I will be irritable. Yes, I feel good, but I'll be irritable, and then I'll be easily distracted. So this, so so there are times when, what you call it? There are times when I end up with a fight, uh with a fight, which I really a fist fight with my abusive father. So we ended the fight, and the police were called. And the police were called and things like that to handle things, and I will end up in the hospital and being admitted against my will. And also during, and that's about it. And I didn't, and during the many episode I was very very busy. I couldn't tell you what, like exact, like pinpoint exact my daily routine during my many episode, because it was all over the place. But during my depressive episode, I will have a depressed mood. I will have no pleasure at all. I don't feel like do anything, and I don't eat as well. I lost a lot of weight, a lot of weight. I remember I went from 56 to 48 kg. Yeah, that's how I lost a lot of weight, because I don't eat. And also I have in I sleep also. I don't really sleep much because I have trouble sleeping. I have no energy. I just feel worthless. And also, there's some days that I would harm myself. I would cut, or I would punch the wall and things like that. And also, I will have a lot of suicidal thought. Yeah, suicidal thought that I would not tell to people. To the point that until I decided to attempt to take my life with overdosing. With overdosing. Yeah. So just now in the beginning I say I got hallucination. So my daily life will be like all the time I will be paranoid. Yes, all the time I'll be paranoid. But how I cope during my relapse, um, thanks to my mother, she can spot when I'm not myself. She can spot when something is wrong with me. What she will do is she will say she'll pack up my bag. I mean she'll pack up my bag, put the towels all inside, and then she say let's go to the emergency. Then I say no. And that time also the police had to be involved. Cause my mom said, okay, if you choose, you go to the emergency or I will call the police. I said, but at the time also I was in the mid episode as well. I said no, I don't want to go. Actually, I'll call the police. I was like, fine, call her, Then she really called the police. Yeah. So few times it happened. The police show up at my door. And it wasn't good. Yeah. So my daily routine when I was relapsing, it wasn't good. I couldn't function, whether in manic or in manic episode or depressive episode. I couldn't function. I really, really couldn't function. Yeah. So I ended up hospitalized, and few times I had to do electroconvulsive therapy due to that. Yeah. So that's it.
I see. So those are quite some challenges that you have to go through daily. Um, so so what give me a moment here. So Dr. Maniam, what are the normal stigmas that you know related to mental illnesses?
Well, some of them Eunice has already mentioned. Um, and I think she has given us a very long list of the kind of struggles she had to face. The challenges she faced are partly because the stigma makes the challenges worse. Okay, people who believe myths about mental illness are more likely to stigmatize people with mental illness because they have no proper understanding. So when they stigmatize people, you're dehumanizing them. You're treating them as if less than human. And as Eunice said just now, instead of treating them as people with illnesses, you just see the illness only. And that's a challenge for the person with illness. You see, the thing about stigma is it sticks not only to the patient, not only to the diagnosis, it also sticks to the psychiatric hospitals. Some people speak about psychiatric hospitals in a very demeaning way. And we know that even psychiatrists are stigmatized. Our medications are stigmatized. Our wards are stigmatized. And this is a real thing. It's a very sad thing that the attitude people have towards things because of the stigma. Now, and this, of course, makes the challenges for the person facing psychiatric illness. When you are stigmatized, how do you find acceptance? It's a big challenge. You want to be accepted as another human being, as any other human being, as a person with hopes and fears and concerns and ambitions and plans and so on. And it's very difficult when you are stigmatized as a person to be accepted. See, that's a big challenge. Another they face is environment. You see, it's again because of the stigma, you find that people who have mental illnesses find difficult to get jobs. And I have, in my experience with patients, I have many patients who tell me that when they have to declare in the form about their health. And if they say they have mental illness, even though they are well qualified for the job, they have experience, they are dismissed, they are told no, rejected, they are rejected. And we can't take people with mental illness. And this stretches even to insurance, Many people with mental disorder find difficult to get insurance, life insurance or health insurance and so on, because most of the insurance companies refuse to cover mental disorder. And in developed countries like Australia, some parts of the US and so on, it's illegal that you cannot deny insurance because they are mental illness, because mental illness is like any other. And so in Malaysia, you find a big challenge for our patients. Then the socializing is a problem. Many people tend to avoid those who have a history of mental disorder. And so there's social stigma. And what you find is long before COVID came, many psychiatric patients were already socially isolated. You see, now people suffering with the COVID down, they know what social isolation is. And this is what psychiatric patients have been suffering for a long time. Even some family members sometimes, reject them and socially step aside from them. They don't want to visit the home. Relatives don't want to come to the home because somebody is mentally ill. And then another big challenge is getting proper medical and psychological treatment. There are many reasons for this. One is, of course, the myth that people believe. They say this is not an illness, this is due to charms and magic and spiritual things and evil spirits and things like this. So they don't take people for treatment. And sometimes because they believe that this cannot be treated by medication, or they take them to the BOMO. And so getting psychological treatment and medical treatment can be a big challenge for psychiatric patients. Sometimes because the clinics are very far away, and the usual doctors, like general practitioners, are not well trained to treat illnesses. So finding a psychiatrist can be difficult unless you're near the city. So this is another problem. I think another big challenge we must understand is taking medicine for a long term. This is a challenge for patients. And when some of my patients tell me they don't want to take the medicine anymore, I try to understand why. And one of the reasons that the medicines have side effects. Well, that is true. All medicines have side effects. There is no such thing as a medicine without side effects. If anybody come and try to push or sell their natural treatments, you take this herb, you take this oil, you take this vitamin and so on, and they tell you that their medicines have no side effects. The reason they have no side effect is this. Listen carefully. The reason why their treatment has no side effects is because it has no effect. When you have no effects, you can't get side effects. But if a medicine is, it always produces side effects. But not all side effects are bad. Some are mild, and some of them will go off after a little while. At the beginning, the body is not used to it, and so you get the side effect. But after a while, it goes off. But there are serious side effects. I know, I understand, I admit that. And when that happens, we warn the patients. We try to take precautions, try to change medicine to something else. So we need to make all these adjustments. So if the patient gets side effects, we encourage them to discuss it with their doctor so that they can make adjustment to dose or change to something else. See? Okay, so this of the challenges, and most of them because of the stigma that people experience. One of the stigma I found was people telling the patient, "You are just pretending. You're not sick. You're just pretending, or you're not praying hard enough." Things like this. These are really harmful. And as I said before, is because people have lack understanding about illness. So this kind of a webinar that you're holding is very helpful. It informs people, that about to get to know about mental illness so that they can treat people and help them better. Okay.
I see. So, Dr. Maniam, based on the patients that you have treated, what are some of the challenges that they have gone through?
Well, I just mentioned some of those challenges. Together with the stigma already. I don't think I need to go over them. Again.
Oh, okay. I'm sorry. 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 This is directed to Eunice. Do you have anything to add?
Yeah. The challenges that I face is what Dr. Maniam said about insurance. I remember that time it was about being denied life insurance because I have mental illness. Okay, like this. So but eventually I got it because I lie on the paper and I have to because I not only mental illness, I have other health issue as well. So I need life insurance. So I remember once I think so many I think so many I think so 4 5 years ago I think I think the in mid where there's always like there's like a convention, right, about then the insurance company will promote their insurance. So Kuan, I don't want to name the company, but then we talk about it, and then me and my friend will go in there and view, and then we take the brochure and things like that. So it happened that the life insurance was quite good. So after that, then I asked because I just want to know what they think. I asked, um, if the person have mental illness, they can't have life insurance, right? They will be denied life insurance, right? And he said, yeah, sure. I said, why is it so? He said, what if they got life insurance the next day they commit suicide? Huh? What if they get it and then they harm themselves because they are crazy? Like that. This is what the answer that I got. But they didn't. But the person don't know that I have one. So I said, how are you sure that every mental illness patient will end up commit suicide? Will end up dying by suicide? How would you know? How would you know? Tell me. And he said because they are all crazy. I said, how would you know they are all crazy? Then he just keep quiet. Then I just asked, I just say crazy in what way? Then he just keep quiet. Yeah, I said, never mind, it's okay. Then you just give me the brochure. Then my friends was like looking at me, Eunice, why are you asking that question? I'm just asking because I need to know. And she's like, and she was like quite annoyed. But I just asked because I want to know what the salesperson think about it. So yeah, but eventually I got it's because I lie about it, and then I just the insurance person said, yeah, your daughter need to clarify that she don't have a mental illness. So we went to doctor and we told the doctor everything that we need life insurance and to deny that I have mental illness. Then things like that because I'm not sure. I know this is like lying, but at the same time, I was thinking I have other issue as well. If I don't get it just because of my mental illness, what if later on I have like other illness, okay, and then things like that. And the second challenges is like from financial difficulty finding a job. I remember every time I go for a job interview, they will ask, "Do you have some either in an interview or either in the form before you interview? You know the form, the application form." So they asked, "Do you have any form of mental illness?" I was sitting there and I was looking and I was staring. Normally people have it no, they will just say no, okay, done. But I was staring at it. Then I was staring also so long. Should I say yes? Should I say no? I was confused. If I say yes, surely I won't get the job. If I say no, and then so suddenly, and then sooner they, and then let's say if I got relapsed, sooner they found out, they will, then I will have a bad record. Because when you want to find a new job, if you have a bad record, it's pretty bad and it's very hard. So for me, this is why it's so difficult for me to find job. And the third is um being the third is difficulty to maintain stability. Yes, I for me is that I have difficulty in maintaining stability. I believe other patients did so. I also have this kind of struggle. Because probably sometimes I'm already like very long already 8 years 9 years into my treatment, and still I have relapse and instability and things like that. This is the challenges that I have to face, and I have to face to make sure that I'm stable, to make sure that I don't get any relapse. But no matter how hard I try, I still get relapse. I still get unstable at times. And this is very hard for patients with mental illness actually. They want to be normal, but at the same time also that illness is hindering them from being normal. And also even though it's like I think so a lot of patients also they ask the kind of question. Even I ask the kind of question. I follow my medication regime correctly. I follow my treatment regime correctly, but still why I have this kind of illness, and it become why I had this kind of relapse. And it's very frustrating. And when you have relapse, and you have relapse as a student, as a student, when I have relapse, I ended up failing all my subjects. That's it. Yeah. So and then it number four is taking my dealing with the side effects with the treatment. As I told before, not only I take medication, but the side effect of electroconvulsive therapy as well. Um the medication, yes, I have side effects from getting rashes to get to not having period. I remember I didn't have my period for 1 whole year. And then to getting like tremors if you take the older version of antipsychotic. You can't walk because you have stiff muscle. This is the bad ones. And then vomiting. And the mild one would be just weight gain and things like, and having pimples and things like that. uh yeah, that's why sometimes at some point in my life I was thinking I'm so tired of taking medication. And also the other one is finding the right combination of medication uh to to treat the illness. For me, I tried many medications, and I tried almost all the medication, all the combinations, but it doesn't work. So that day I go recently I did ask doctor, is it possible if I have a resistant type of mental illness? She said yeah, it could be possible. Then and things like that. And yeah, and I'm afraid that I might have a what you call it, treatment resistant type of mental illness, which if I have a treatment type, then I have to go for ECT, like maybe ECT treatment. So yeah. And the last one is being judged. As just now I said the police have been involved when it comes to handling me before. Either fight or my mom call them and things like that as many times. um for me is I remember I become enraged and I was out of control for many times because of my manic episode, and the police were called for many times. And because of that, I was being judged as someone sick in the head. or someone that is unreliable, someone that I've just built a bad reputation in my neighborhood lah, just totally a bad reputation. But yeah, that's how I got this stigmatized um and discriminate, yeah, because of what happened also. And the discriminate, and beside from the discrimination, I have to um face them every day, face my neighbor every day, my neighborhood those in my neighborhood every day, and keep my poker face. Yeah, that's all my challenge.
I say, okay, thank you, Eunice. So, Dr. Maniam, um, how can we, as caring friend, help a patient with mental illness if they were to come, if they were to approach us seeking for help?
Okay. um, the most important way of helping people, your friends who may have emotional, mental difficulties, is listening to them properly. I cannot overemphasize this. In my opinion, for non-professional people and even professional people, all begins with first listening properly. Now, listening is a skill. It's not just a matter of hearing and the sounds coming into our ears. But listening involves a number of things. It involves paying close attention to what the person is saying, not being distracted with other things, but paying attention, concentrating on what they are saying. It involves empathy, trying to understand what is the feeling this person is having. What do they feel when they say this? What kind of emotional experiences they are going through? As best as possible, we try to understand. We may not fully understand what another person is experiencing. It's okay, but we must try to understand. We must listen without judging the person, without condemning the person. So if the person says, I feel like ending my life, you don't judge them. Oh, you're so bad. You're a sinner. You will go to hell. You are, you're too weak. You're not strong enough. You're this, that, and so on. That is judging. Rather than listening, why is this person? It must be a terrible experience for anybody to feel that they want to end their life, to think that they are going to commit suicide. You see. So the thing is, listen to understand. That is the most important skill. Now, when you watch people talking, you notice that people are listening, reply, not listening to understand. You see the difference? There's a difference. If you're only listening to your friend so that you can reply something, you're not really listening. You must listen to understand feelings, their experiences, their thoughts, their troubles. That is real care for your friend. Then the second thing is, when you want something, be careful you don't share your ignorance. Like the examples that Eunice gave just now. And she said, I feel like this and this. They say, are you praying enough? Your faith is not strong, or things like this. That is because they are ignorant about what illness is. You see, we mustn't share our ignorance. If we don't know what it is, better to read up and find out first before telling things that might be harmful for them. Offer practical help. So if one of your course mates is unwell, hasn't been sleeping well, is not attend class, misses some of the lectures, then offer to share your lecture notes with them. May offer to do revision with them, and it's real care and concern for people. In fact, I have seen a lot of unkindness because when I was teaching in the university, I find some students who have illness came to me and I asked them, do you get help from your friends for revision and so on? They say, no, all my friends avoid me. If they join their revision group, I will slow them down. So they don't want me. They want to choose all the good students to revise, which is, we can understand it, but it is it's not helpful. It is kindness to people who are suffering. Then another way of helping people is suggest where they can seek help. When we listen to our friends, we may not be able to help them very much. That's okay. There are other people who can help them. Maybe they can go to your lecturers, maybe they can go to your unit counselors, or to doctors, psychologists, and so on. You can suggest. Sometimes when people are very ill, they don't think very, they feel that, nothing seems to work. I don't know what to do. That's when you can help them seek help. Take them along, if you like, to the counselor and say, my friend needs help, and so on. That will be very helpful. Never joke about illness. Never joke about it. Don't make fun of it. I find this very, very, I get very angry when I hear about mental illness is real suffering. Joke about suffering. You don't joke about people having cancer or heart attack, or having a stroke and they cannot walk. You don't go around joking about them. In the same way, we must not joke about it. That's extremely. One more thing I will say about helping people is when you find your friend has suicidal ideas, he talks about, or she talks about, I don't live more, life is too difficult, and so on, then it's very important to do certain things. One is to find out more about what are their plans, what are they thinking about doing, because when you know that, then you can help in prevention. Ask specifically about their plans. Secondly, never leave them alone. Don't leave them alone. Okay, don't do this. Okay, be good. Tomorrow I'll come and help you, or I'll come and visit you, or go and see a doctor. Don't do that. Take them to somebody who can help, either to their home, their relative, or to a clinic, or to a counselor. The reason I emphasize is in my experience, I have found people who have died because the people they talked to didn't take it seriously. You see? Anyway, for everyone, not only for people who have mental disorder, but also for all of us, there are some good habits that help promote our mental health. And I want to mention four of them. One, exercise regularly. Exercise regularly. There is evidence that exercise promotes mental well-being and helps the brain, improves memory. Secondly, have adequate sleep. Adequate sleep is something like 7 to 8 hours. For you younger people, 8 hours is better. For me, maybe 7 hours, all right, So adequate sleep of 8 hours, preferably at night, not in the daytime. So we go to sleep when the sun goes to sleep. When the sun wakes up in the morning, we also wake up. I know it will be difficult for some students who sleep into the night. You see, what you're doing is you're disturbing the brain's rhythm. The brain has a natural circadian, we call it, it's a daily rhythm. And a lot of things happen in the night during sleep. The hormone secretions and blood pressure and pulse changes and so on. So our body actually is doing actively certain things in the daytime and actively other things at night. And so it's important to sleep at night and don't be on the screen for too long. Either your iPhone screen or your computer screen too long because it disturbs in the night. It disturbs the rhythm, the body's biological rhythm. Eat proper diet, healthy food. We don't eat so much junk food, fast food, and so on. Healthy food. And lastly, socialize adequately, adequate socializing. Spend time with friends, spend time in some leisure activities, and so on, which is good for us. I know nowadays with the MCO and so on, social isolation, people talk about social. Actually, I think it's not social isolation, it's only physical isolation. You can still talk to people over the phone. You can talk to people by this kind of WhatsApp and Facebook and things like this, but you have to be physically isolated. So these four things are very, very important. Okay, exercise, sleep, proper diet, and adequate socializing. Okay, so these are the ways that we can help people and help ourselves. All right.
All right, thank you, Dr. Maniam. How about you, Eunice? How would you want your friends to help you or to support you if you do need their help?
Um, Actually, right, since I'm already in treatment for quite a long time, but let me just tell you a brief story of how I did not get the help I want, and after that I'll go to the point of how I want people to help me. Alright. So, mm, so I developed some symptoms when I was very young. I think around 8 or 9. I couldn't sleep and things like that. And when I enter to high school, I my symptoms begin, but no one saw it happen. And when I reached 15, just when people can see. But because during those times, now I'm 25. It was like 10 years ago. It was 10 years ago. So that time there's not much about mental health awareness or or education about mental health. So in my early years, but then there's no education, so people were just if let's say people if let's say someone were to know that um other people were diagnosed with mental illness, and they'll start showing those myths around, those untrue statements around. So so I didn't back then I didn't get, earlier I didn't get the help that I wanted. And even discussing about mental health issue was a taboo back then. So people threw and then even people didn't help me at the time. No one helped me. Even that time also, since because they don't have the mental health awareness program, even I myself believe about the myth of related to mental illness. Okay, I even made fun of it myself before I was diagnosed. I was ignorant towards this issue, but when I start developing symptoms during my teen years, I remember my mom asked me if I want to see a doctor. That one was when I was 15. She said, you're depressed. Do you want to see a doctor? And because I have this mindset that if depressed is only for weak people and things like that, I will not have one. I will not. And she said, go. I said, you're not eating, you're not sleeping, and things like that. Uh, then said, go and see lah, never mind. I'll accompany you. I said, no, no, no. I'm not going to see a psychiatrist. I'm not crazy like that. Then after that, uh, then after that after that when I was 16, my symptoms get worse and things like that. At the same time I got bullied as well, and then when I was 17, she really begged me to see the doctor, to see a psychiatrist. So yes, I did. The first thing I was reluctantly say yes, but and then I go. Then she said, then we make an appointment and things like that. Okay, I was telling myself, okay, Eunice, calm down, everything will be fine. But the moment when I see the psychiatrist, I sat at the couch or on the couch, I started crying before I even uttered a word. So that's how from there I got my treatment. And but at the same time, the first time I got treatment, I was ashamed. Of course, I was really ashamed. Then but the treatment didn't went well, and I went in school. I went to the counselor, and also there's two other teachers who are quite sympathetic and empathetic also. So thank you, and and one of my friends. So I was ashamed. I didn't follow my medication regime. But then I followed, but it was an SSRI, so it made me even more unstable. So I ended up hospitalized. I was self-harming. Then after I came out, all hell broke loose because um I was being stigmatized after that. I don't know how they knew. I don't know how the student knew I was hospitalized in a psychiatric ward. I didn't know. I was 17 at the time. I didn't know. I came out and that's it. I got discriminated. I got stigmatized. Everything, everything bad happens. So no one helped me. No one even cared to ask me if I was okay, except for my two teachers and my counselor. Um, and I was made fun of. Yeah, I was made fun of and things like that. And at that time also, I was still denial because very hard to accept when I was diagnosed with a mental illness. I was in denial. I refused. I still I still refused to go for an appointment and things like that. But eventually I did, and I got the help that I needed. Mm, but then I was still unstable. Then no one helped me at all. So during those time was quite different. Um, but I would say back then, if let's say I beginning back then, uh, and also now, how I want people to help me is don't judge me first of all. Listen to what I have to say first. Don't interrupt me. When I'm explaining things, like don't judge, say I'm weak or the evil spirit. Because of I was like this because of evil spirit and things like that. um be patient. Yeah, I maybe how do you say this, not only me lah, I think so other mental health patients could be very difficult to deal with. Also just be patient, and also at the same time don't throw any any bible verses at me. Yeah, especially in church, don't slap me with bible verses or like tell me to go and pray and things like that. I did all those things. Okay, I did. I go for YouTube, I go for sermons and things like that, yes. And also don't lecture me on how not to get mental illness. Don't lecture me unless you have read about my illness. don't lecture me. I remember I was having a lecture. I was being lectured for an hour just because I tell them that I was suicidal and things like that, and I was sharing it. And also treat me with respect and dignity. Okay, I know I may be unstable and things like that. Uh, but also treat me with also with other patients also lah. Treat us with dignity. Respect and dignity. Treat us like a normal person. Don't treat us like don't see me. Don't see me or also others. Don't see us through the lens of our illness. Okay, treat us like a normal person. Treat us like how you would be a normal person. I would say because it is how to say I would just I wouldn't say it because it doesn't feel nice when people just treat you based on your mental illness. When people just see your illness, they don't see your they don't see yourself. The same lah when people just say I'm always unstable and things like that. I'm dangerous. My neighbor was like because they see the police came to my house and escort me out to the police car, so they have the wrong perception that I was too dangerous. That's why the police came here and escort me to the hospital and things like that. So yeah, but it was I felt very offended when people just doesn't treat me like a normal person. I really feel offended to be honest. And also don't tell me to stop my medication, to stop my treatment. No, once I start already, yes, last time I was in denial, I want to stop my medication, but now I'm an adult. I'm more educated about mental illness now. Medication is very important for me. Don't tell me not to take it. Don't tell me stop your medication, take herbal medication, take this homeopathy medication. Don't tell me to do that. Yes, it may help maybe, but I still need my medication to actually survive as a normal person. And also trust me, I'm a responsible person as well. I'm not unpredictable. You can I usually even if I get relapse, it's not that I'm unpredictable. Yeah, you can trust me as well. You can give me any task and I will complete it. It's just that maybe it will take extra time for me. But yeah, just treat me with respect and dignity and other with mental illness as well. Yeah, that's it. Thank you.
Hey, thank you very much, Eunice. I guess to sum it up, at least the least we can do as a friend is to listen to them, to be kind, understanding, and empathize, to be supportive towards our friends. When they come to us for help. Right. Okay. Okay. Right.
Yes.
Finally, we have reached the last part of our webinar, which is the Q&A session. So anyone watching through Facebook or YouTube, if you do have any questions for Dr. Manian or Eunice, please don't hesitate to write them down in the comment sections below, and we will answer it as soon as possible. Okay.
Hi guys, so you guys can write the comment down and we will try our best to answer your questions. Anyone?
Morning, Tasha. Morning.
Alright.
Hi guys. Do you have any questions that's related to the topic that we have been discussing just now? If you do have any questions, please leave them down in the comments below. Yeah. For to answer Tasha's question, you can just email Circuit College Kuala Lumpur email for more information.
So any related question to any question related about this mental illness stigma, perhaps you can direct it to Dr. Maniam and or me.
Hi, Eunice. Eunice, Tasha would like to wish you all the best in your academic.
Uh, thank you, Tasha. Thank you, Tasha. Thank you very, very much.
I also like to congratulate Eunice. She's very brave, and in sharing herself, I hope it helps a lot of people, in similar situations to come and seek treatment and go on with their lives rather than suffer silently. So, congrats, Eunice.
Thank you very much, Dr. Maniam. I'm actually very glad when I had when my lecture when my lecturer asked me to do this. Yeah, I've gone public before, so my aim is to to spread more awareness and also to try and reduce the stigma. So yeah, thank you very much, Dr. Maniam.
Welcome.
May I know the one? Okay, so Crystal Lim. So you asked, hey Eunice, this might be rather impolite. Okay, may I know what is the worst comment? What is the worst comment you gotten from your family at the beginning of your illness? Okay, the worst comment that I gotten from my family was, Eunice, I think next week we have a prayer rally. I think you should get healed. I think there's an evil spirit here lah. And all take this medication. Don't take this medication. This medication, do you know when you take this medication for a wrong, like it will affect your kidney? Or Eunice, why can't you? Why are you so lazy? Eunice, depression is not really like that. You know why are you so lazy? Why you keep sleeping? Like your cousins can do better than you. They sleep late, they do two jobs, they sleep late but they still wake up early. But why can't you do that? Why can't you be like your cousins? Yeah, this is the most hurtful because I was being compared a lot of time. Yeah. Can this illness cause hair loss? Uh I think maybe some of the medication can cause hair loss, but I've never heard of anyone uh having hair loss before. But what I know from my experience is medication do cause hair loss actually. Yeah, it does have that effect. By question by Sharon Shakira. Yeah, Sharon Shakira.
Sometimes stress can cause hair loss. So if a person is going through a lot of stress and they can have some hair loss, but usually it's temporary. And once the stress is over, they'll be all right. But you're right, some medications do cause hair loss. And in that case, again, if you change the medicine or lower the dose, usually the hair grows back. If you stop the medicine, the hair will grow back. But I mean, illness, have a choice. You can't stop the medicine. So you may have to change to another type of medicine. Not all medicines do that, but some of them do. That's true. It's a real concern for some. We take that concern seriously, and we try to minimize it by changing dose or changing to different type of medicine.
It could be, let's say, if you have anxiety, then because anxiety people tend to a lot, they pull their hair off uh a lot, so that will cause hair loss as well. Like Prof Maniam say, if like stress, some people when they usually like they just like clench their teeth and things like that, or they pull their hair like pull their hair, then yes, yeah, you can, that will cause hair loss as well.
Okay, I think that wraps it up lah. If there's no more comments, no more new comments, or no more new questions. Okay. Thank you very much, Dr. Maniam and Eunice, for sharing the facts and myths on and the stigmas of mental illnesses. And thank you very much for everyone for joining this webinar. I hope that you can learn a thing or two about how people with mental illnesses are stigmatized, and how we should work together to understand and respect people with mental illnesses, because they are still human too. They are still one of us. They are living beings. They have feelings and everything. Okay, and we should abolish these stigmas towards mentally ill people. So that's it for today, and there will be a that's it for today, and there will be a feedback form in the comment sections. Kindly ask you to fill that up for our record. Thank you very much, and
Bye.
um, okay, goodbye. Thank you very much for joining,
Bye.
everyone.
Bye, everyone. Bye.
Bye.
Goodbye. Thank you very much.
Bye. Thank you very